for the update. The Nationals are calling on Labor to step up and improve general practice. It's following the news that of the 39,000 GPs working at the moment in Australia, almost 3 in 10 of those intend to retire in the next 5 years. Well, joining me live is Shadow Assistant for Regional Health Minister Dr. Anne Webster. Thank you so much for joining us. You write that they have had enough, these GPs. What are we needing to do here?
Well, what we're reading in the State of the Nation report is that doctors are feeling under pressure from compliance, the amount of compliance they've got to go through. For example, a GP practice has to go through accreditation every 3 years. It costs them tens of thousands of dollars to go through that process, takes staff away from their jobs in order to tick boxes. That is incredibly onerous on GP practices who just want to be there to serve the community and provide patient care. That's one of the issues, I believe, is around the red tape that is currently being required of GPs. The other thing is around remuneration. We know that Minister Butler is talking about the improvement to the bulk billing incentive. Well, that's a tiny proportion of the Medicare rebate. It frankly is not enough, and that is also an issue. So doctors are spending a lot of money on compliance. It is incredibly onerous, and they don't have the numbers to support them. So if they want to take on supervision of younger doctors, which again we need them to do, that takes them out of their practice as well. Meanwhile, as you said, Jaynie, 3 out of 10 are looking to leave practice. Now, whether it's because they're retiring, I know in my patch in Mallee we have 58% of doctors are aged 55 years or over. If we're going to replace those doctors, we're really looking for 2 to 1 due to the full-time equivalent change and how long doctors used to work, and some of the older ones still do, and how many hours younger doctors are wanting to put in for work-life balance. So there are a lot of issues here, and the distribution priority area expansion that Butler brought in immediately he stepped into office, of course, has drained our regional communities of GPs, and they have gone to, many of them, 56% rise in the number of doctors who are leaving regional communities and have gone to the outer suburban areas of our capital cities. We're in a world of pain in the regions, and the Labor government just doesn't seem to register that.
It's very interesting and confronting those statistics that you mentioned, Dr. Anne Webster, because, I mean, we had the Bush Summit a number of months ago, for example, and plenty of surveys were showing that around 20% of people living in metro areas were seriously considering moving to regional Australia. So they want to leave the cities, but then we have, as you mentioned, so many doctors moving for various reasons, getting out of the regions. This is really quite disturbing. I spoke to Tanya Foster, who has her own collective hub in Dubbo, and she said in the Dubbo region alone, in the past around 18 months, there was about 3 practices shutting down, and that's a huge area, as you know. And again, we're just seeing so many people leaving. What kind of incentives do you think need to be implemented for GPs?
Look, I think we have to start right at the base, the training, the selection of student cohorts to go into medical training. The ATAR is around 99.9 if you want to go to a sandstone university. That does not mean that that particular person who might be academically incredibly smart is going to be a great GP. So I think the selection criteria is an issue. Where doctors are being trained, we need them to train in the regions. I am absolutely committed to that process expanding. We have some innovative training programs already underway, such as the Murray-Darling Medical School, which came under the Nationals in government, and we need to expand that. We need to see more students training in the regions, and this is a complicated issue. We have not only a maldistribution of general practitioners being in the city rather than in the regions, we also have a maldistribution of the number of medical graduates who are choosing specialties and subspecialties. This is an error of planning over many years. So the colleges, the universities, the hospitals, in the needs that they have, there needs to be far more strategic a strategic eye put to the problem that we're now facing. It didn't happen yesterday. I acknowledge 10 years in coalition. It was also the previous years before that, but it's also to do with the colleges and the priorities that they're setting, and the universities and the Commonwealth supported places. So, you know, there's a lot of work to be done, and the training component is the first part. So you've got a short-term, medium-term and long-term change that needs to take place, and policies that I'm developing to go into the next election will be addressing many of those.
All right, well, we look forward to hearing more on that, Dr. Anne Webster. We do have to wrap it up, but really appreciate your time. Thank you.
Thanks, Jaynie.